every day. But I've said from day one that while we may be one of the first to go into this, my goal is to get us to be one of the first out of it and to have a healthy workforce ready to go.
Another important factor is the ability to do contact tracing and being able to warn people who are exposed to a sick person. At today's briefing, the state health commissioner did not rule out a statewide mask requirement. And the Indiana State Department of Health reporting today an additional 440 confirmed cases of the coronavirus, putting the state's total at 8,955. There have also been 49 new COVID-19 deaths since yesterday's report. That brings the state's total to 436 deaths. The new numbers show over 48,000 people have been tested statewide. The state has not provided information on recoveries.
As the debate continues from the White House to the State House as to when to reopen America and Indiana's economies, the coronavirus outbreak models the experts depend on give varying answers. CBS 4's Russ McQuaid has been closely following the projections and tells us the best local model says Indiana hasn't hit its peak yet.
The answer to how much longer these Marion County streets will stay empty, say the experts, is in the numbers.
45% of Indiana's ICU beds and 74% of its ventilators are still available for the most seriously ill Hoosier COVID-19 patients. And that means when the surge hits, the state's hospitals are well positioned to handle it.
We're interested in looking at where people are and where we think kind of the next wave will be.
A study by the Fairbanks School of Public Health looks at the county-by-county data to predict when the surge will hit Indiana.
We believe that Indianapolis and the rest of and the other parts of the state will hit their peak over the next few weeks into early May. Our level of hospitalizations in the center part of the state have been flat. In other parts of the state, they're still climbing up.
A model by the Institute for Health Metrics and Evaluation based on general overall state numbers once predicted the Indiana peak would hit last week. And then earlier this week, it still expects more than 800 Hoosiers to die from the coronavirus, which is about what the Fairbanks model is also forecasting.
All of the models that I'm referring to are right in that ballpark of around 800 or 900. Again, with the caveat, as you said, those numbers have fluctuated. It looks like they might be stabilizing, but we'll have to look and see what tomorrow holds. The general trend has been towards stabilizing down under 1,000.
And the analysts say Indiana may have undercounted earlier deaths that weren't identified as positive cases, and that could add to the mortality total.
We continue to backfill in the mortality statistics and continue to learn more about what the case presentation looks like, so that an astute clinician may look at this and say that looked like it was a COVID-19 case.
When I asked Dr. Granis whether or not he intends to take his wife out for Mother's Day dinner on May 10th, he says he expects they'll be dining at home. In downtown Indianapolis, Russ McQuaid, CBS 4 News.